Measles is a highly contagious viral infection associated with a red blotchy rash on the skin. The measles virus spreads through the air via tiny particles or droplets when infected people cough or sneeze. The first symptoms your child might present typically includes fever, tiredness, coughing, and runny eyes, with a rash that starts on the face or neck and spreads to the rest of the body. The rash can appear red with raised spots but isn't itchy. Measles can cause serious, sometimes fatal complications. In some cases, it can cause lung infections, blindness, and brain diseases. If you're concerned about your child's symptoms, seek prompt medical assessment. Vaccination is the best way to protect your child from measles. The measles vaccine are combination vaccines that also protect against mumps and rubella, and for the 18-month dose, it also protects against chickenpox. This means your child will be protected against more diseases with fewer injections, causing less pain and distress for your child. Under the National Immunisation Program, children should receive the free vaccine at 12 and 18 months for the best possible protection. The vaccine provides immunity to measles to help prevent your child from getting the disease. It contains a weak and safe form of measles and trains your child's immune system to recognize and protect against the real infection. The first dose is 96% effective, and the second dose is 99% effective in protection against measles. Vaccination reduces the chances of getting measles, and if children do get it, they have less risk of serious illness and hospitalization. Your child may experience mild reactions to the vaccine, which usually disappear within a few days. Common reactions include redness, swelling, and soreness at the injection site, and it can also include a mild fever and tiredness. Measles was very common in Australia before the vaccination was added to the National Immunisation Program in 1993. Measles can still be spread between infected travellers who bring measles into the country and through unvaccinated people. This is why we continue vaccinating to keep everyone protected.